Thank
So
you.
thank you everybody for joining. My name is Sean Healy, and I'm here to discuss the brand new interdisciplinary Masters in Health and Social Inclusion. And it's offered through the School of Nursing, Psychotherapy and Community Health here at DCU. So first of all, just why health and social inclusion? Well, we see these as two of the most urgent issues that are facing us today in Ireland: health inequities and social exclusion. And for those of you who might not be familiar with these terms, when we talk about health inequities, we're talking about differences in health status or the distribution of health resources, like maybe accessing health promotion activities or health care services, etc., between different groups of people arising from the social conditions in which people are born, grow, live, work, and age. So really we're talking about differences in health that are unjust, that are avoidable. So they're not like genetic or biologically caused differences in health. And then very closely related to that, and a key kind of determinant of our health, is the idea of social exclusion, which is that state of disadvantage that is faced by various groups in Ireland and indeed internationally, who are felt to be removed from mainstream society and who cannot fully participate in normal life. So they're marginalized groups, or they're groups that are kind of at the fringe of society and aren't active parts in our, active members of our society. And health inequities and social inclusion are very closely linked, and they're experienced by various populations who experience things like poverty, maybe people of certain ethnicities, people of certain ages, maybe people with addictions, with disabilities, etc. So within Ireland, we have various communities who bear burdens related to health inequities and social exclusion. And this, as you can imagine, has severe and enduring effects on the health and social well-being of many individuals and communities within Ireland. And so in this Masters, we try to tackle that head on. We try to address the health inequities and the social exclusion that occurs in Ireland. And this is a really recognised issue in Ireland. And just very briefly, I wanted just to bring your attention to maybe the severity of health inequities and social exclusion in Ireland, and indeed the importance of health and social inclusion. Well, the HSE, for example, recently made a call that all healthcare workers need to be provided with education and training related to the effect of health inequities, especially in disadvantaged populations. And COVID really brought this to light, that certain groups and communities within Ireland fare better than others when it comes to health. So we are, trying to address this call. Similarly, Healthy Ireland, a framework which provides kind of an overview of the actions that will be taken by our government and indeed non-governmental organisations in Ireland to improve our health. But they also recognise that we do need to focus on the wider determinants of health to address health inequities in Ireland. So we're not just focusing on health care, but we are paying careful attention to those social determinants of health, considering how people, where they are born, where they grow, where they live and work and age. And we take on this perspective in this Masters, this broad social determinants of health perspective. And finally, just to kind of reinforce the importance of this topic and why we have developed a Masters in this area, our Sláinte Care report also acknowledged the importance of focusing on the social determinants of health and equality. Again, recognizing that there's complex factors at play which affect different groups of people differently, leading to health inequities and social exclusion within our communities. So it really is a national priority that we are responding to here with this Masters. So what do we want to do? Well, in this programme, our overarching aim is to enable you, the student, to understand and influence health and social inclusion in Ireland and abroad. So more specifically, we want our graduates to fulfill 3 objectives. They're going to leave capable of identifying and analysing the major underlying causes of health inequities and social exclusion. So that's that social determinants of health perspective, where we're going to try to help our students get out of the silos that sometimes we're stuck in health promotion and health care and social care services, and see that broader picture about the factors that influence our health and social well-being. We're very practical or practice orientated in this Masters, and so our students are going to leave capable of designing, implementing and evaluating interventions to improve community health engagement and social well-being. And finally, as it's a master's level, we are going to ensure our graduates leave with advanced skills in health and social inclusion leadership, research and practice development. So they can go out and be the drivers that reorientate our healthcare, our social care systems out there. So they're the 3 kind of main objectives, that they're the real pillars of this master's program. So in our modules, they'll cover things like frameworks and strategies for tackling health inequities and social exclusion. We'll be talking about how we can engage in capacity building in our communities, how we can do participatory approaches whereby we engage and reach marginalized, traditionally hard to reach communities and get them involved in various health promotion, in various social inclusion initiatives. We're going to also teach and get you actively involved in leadership, management and innovation in health and social care practice. Again, recognizing that this is a national priority. There's going to be a need for leaders out there to work in this field. We're also going to have a very strong focus on health promotion, as some of our graduates may wish to enter the field as a health promotion practitioner, again with that special expertise on targeting marginalised, hard to reach populations. We're also going to have modules focused on health, research methods and program evaluation. And I think maybe interestingly, for a master's program, we're offering a choice for our students to do a research dissertation or a thesis, or else they may do a practice development project. And we think this might be attractive for students, whereby those who are very interested in research, they want to use research to maybe improve their practice, or maybe go on to do further, maybe a PhD, for example, they may opt for that research dissertation or thesis option. But some of our students, they may want to work hard, maybe in a local organization, to develop a practice development project, working on a very specific aim to improve or maybe to achieve an aim within that organization, maybe in providing a service to a marginalized population, for example. So students have a choice there to do a thesis or a practice development project. So who are our students? Well, they are going to be a diverse group, because by the very nature of health and social inclusion, we are going to be attracting students from healthcare, from social support services, who wish to develop their own professional competencies, and maybe who are especially interested in working with marginalized populations within their work. We also may have individuals who wish to pursue maybe academic pathways, or want to focus on research or policy development careers. We have a very strong emphasis on that as well in our masters. So we're going to be, we think, attracting a diverse student group who are going to go on and be employed in various sectors. Some of our students, including many of those who have expressed interest in the masters already, they're going to exit and work in inpatient and community health and social care settings, responding to the needs of marginalized communities, whether that's people maybe with addiction, or maybe people experiencing homelessness, or people with disabilities, for example. The strategies we teach are going to be useful for various marginalized groups. We will have some graduates who will work with various statutory services like the HSE, non-governmental organisations, health promotion practitioners, or academia and research. Our programme format, it is going to be offered as a full-time programme or a part-time programme, and it will be delivered in a flexible, blended learning format, meaning that our students will come into campus and meet the instructors and the lecturers over 3 on-campus learning blocks each semester. But between those learning blocks, there will be synchronous online interaction with your instructor or lecturer. And then throughout the semesters, there will be directed or independent learning activities which your module coordinator or lecturer will work with you to make sure that you are getting what you need from the lecture or from the module. Entry requirements. Applicants will typically hold a level 8 honours degree. This will come from a variety of fields, but potentially fields such as nursing, medicine, psychology, social work, public and community health, etc. So again, we are going to have a diverse student body here in this Masters. Or we will also offer opportunities for students to potentially access the programme via the recognition of your prior learning or your prior experiences. We're going to take that on board as well in the application process. So we have a website which I encourage you to have a look at. If you Google DCU Health and Social Inclusion, you will see our webpage. And of course, I invite you to email me any questions as well at sean.d.healy@dcu.ie. Or we have maybe a minute or two as well where you can feel free to enter any questions into the chat window here, and I'm happy to answer them now as well. But thank you very much for your time, and please do reach out if you're interested or have any questions, and I'd be delighted to get in a phone call with you. Clodagh, thanks for your question. At the first year, we're going to have 15 places on the course, and it'll increase slightly in year 3. We do intend to keep it small. We value that close kind of relationship between instructor or lecturer and student. So we intend to keep it nice, tight, small cohorts of about 15 students. I see we have a couple others typing questions. Yeah, it's going to be, in total, it's going to be 6 days, Windy. That's going to be 2 days in week 1, 2 days in about week 6, and 2 days in about week 12. And between that, as I said, lots of online interaction with your instructor. So lots of face-to-face and online time with your instructors. Thanks, Wendy. Hi, Faith. Faith, we certainly are going to be preparing our students in this master so they will graduate capable of entering PhD programs. And there is funding within the school to support some students to do a PhD. So certainly, if that's something you're interested in, please reach out to me. But certainly our students will be ready to enter PhD programs. And while we don't have a formal PhD program in this area, there would certainly be opportunities to focus your PhD studies on this topic. We have many people with expertise in this area that I could introduce you to. I think that we're coming probably to the end of my time. I don't want to eat up my colleagues' time. So with that, please email me. We can get on a phone call. But thank you all very, very much.